Welcome back. We're going to continue on the respiratory emergencies pathway with discussions about diseases of the lower airway that are infectious or environmental in nature. It's worth noting as we start this, when dealing with any infectious process and or a patient that has an underlying infection, we should be taking extra care to ensure body substance isolation with the use of appropriate personal protective equipment or PPE. And while if we're practicing standard precautions, we're taking these precautions with every patient, it's worth noting that complacency can sometimes get in the way, and especially dealing with patients with respiratory infectious diseases, the aerosolization of that material and those infectious agents can cause a significant risk for providers and bystanders in exposure to those diseases. And we need to make sure we're taking the adequate precautions. Let's start off our talk by looking at pneumonia. Bacterial pneumonia will come on quickly, and typically these patients present with a very high fever. Viral pneumonia presents more gradually and is often less severe. In either case, the patients will appear with respiratory distress and dyspnea, and there's a high contagion rate, so it can especially affect people who have immune compromise or are chronically ill. Make sure as part of your assessment, you're assessing the patient's temperature. You should measure the temperature. If you're going to assess it orally, again, make sure you're taking appropriate precautions. And you may need to provide additional airway support and supplemental oxygenation for these patients. Treatment for these infectious diseases will ultimately come down into treating the underlying infection. Our care in the pre-hospital environment is going to be ensuring the adequacy of airway breathing and circulation and providing supportive care and really treating the symptoms that may present with each of these diseases. Respiratory syncytial virus, or RSV. This is the most common a common cause of illnesses in young children. It causes infections of the lungs and of the airway passages. Especially when we've talked about this with some of the other infectious disease processes, make sure that we're checking for signs of dehydration. So your assessment should include things like assessing capillary refill and skin turgor, or evaluating for dehydration there, looking for physical presentations, signs, if you will, of that dehydration. Make sure you treat any related airway or breathing problems, and humidified oxygen can be helpful with these patients. You're going to be basing a lot of your treatment decisions here on the presentation and various signs. And so we're listening for things like wheezing to indicate constriction of the lower airways, or stridorous respirations to indicate an upper airway occlusion, and we'll treat those accordingly. Bronchiolitis is a viral illness that's often caused by RSV. This typically affects newborns and toddlers, and the bronchioles become inflamed and swell and fill with mucus. This can later lead to dehydration and other complications. For these patients, you're going to frequently reassess them and ensure adequacy of respiration and ventilation efforts, and provide supplemental oxygenation therapy when the patients are hypoxic. Influenza type A is a very infectious disease that has respiratory system implications. It became a pandemic in 2009, and the symptoms include fever, cough, sore throat, muscle aches, headache, and fatigue. It can also lead to pneumonia and dehydration as well. You should be sensing a bit of a theme here, that all of these upper airway infections or lower airway infections and respiratory states can lead to pneumonia, which is ultimately a deep, low airway infection that carries a relatively high mortality rate. So we want to make sure that we're helping prevent these conditions from occurring and supporting these patients and getting to the long-term treatment that's needed. ARDS, or acute respiratory distress syndrome. This is seldom seen in the field, although we did during the post-COVID and during the COVID era see a significant increase in ARDS in the field setting. It's caused by diffuse damage to the alveoli. These patients can experience significant cardiovascular compromise as part of the association with this, and can lead to states of shock. These are very sick patients and present as such, with lethargy and oftentimes unresponsive or nearly unresponsive. Aspiration of gastric contents is another complication with these, as well as pulmonary edema and profound events that are hallmarked by hypoxia or states of hypoxia. COVID-19 or SARS-CoV-2 is similar to the virus that causes the common cold, but it preferentially affects elderly patients, those living in close quarters to one another, and those with weakened immune system. This is very similar in the vector to tuberculosis, in that patients who are already immune compromised or patients who live in close quarters with one another, the disease can spread rapidly. It is transmitted by aerosolized droplets and airborne particles, and respiratory deterioration can occur rapidly. There seems to be, as evidence is coming out in this sort of post COVID era, there are concomitant factors that lead to an increased risk of morbidity and mortality, things like obesity, and then, of course, underlying respiratory disease and extremes of age. So, as we learn more about this disease in the years that come, it's important that we're aware of transmission requirements and exposure requirements and making sure that we support the patients adequately with symptom support and get the patients to the proper definitive care to engage in long-term treatment when necessary. Tuberculosis is a bacterial infection that most often does affect the lung. Tuberculosis, unlike some of the other infectious diseases that we've talked about, can remain intact and dormant for years. Patients often complain of fever, coughing, fatigue, and tuberculosis is hallmarked by night sweats and weight loss. So it's important here to dive into the history a bit for the patient and ask about these things specifically, because tuberculosis, much like SARS-CoV-2, is extremely contagious, particularly for patients who live in close quarters or to other patients who are immune compromised. Make sure that you're wearing gloves and eye protections and an N95 respirator at a minimum if you suspect a patient is suffering from tuberculosis. Environmental or industrial exposures, this can be a number of chemicals and gases, including pesticides, cleaning solutions, chemicals, chlorine, and other gases that can either be released by chemicals that were mixed or just released in the environment. Our fellow first responder friends in the fire department are also at risk of exposure. So if you're on fire standby, you should be vigilant and aware as you help assess these patients or help rehabilitate providers that are working in a fire scene and watching for gas exposures. Carbon monoxide is one of the most common. It is an odorless gas that is highly poisonous. It's produced as a byproduct for appliances that burn fuel. So the combustion of gasoline or other organic materials, propane, can off gas as a natural byproduct carbon monoxide, and can be dangerous. It displaces oxygen from the hemoglobin. The affinity for carbon monoxide is multitudes higher than oxygen, and so it binds to the hemoglobin in the circulatory system and prevents the onloading of oxygen and prevents the offloading of carbon dioxide. Other toxic inhalants are noted here. Their acuity is generally seen or correlated with their solubility with water. As we know, the respiratory system is lined with mucus, and so things that are more water soluble will have a more significant and more lasting impact into the pulmonary tissues. So things like ammonia, which is a highly water soluble chemical, it will have acute airway irritation, and you'll see upper airway presentations for those patients, while gases like chlorine that are only moderately water soluble will tend to settle down into the lower portions of the airways of the lungs. So you'll hear sounds like wheezing or crackling, rales and rhonchi as lung sounds, or those wet lung sounds deeper into the lungs.